Okay, hi, my name is Drew. I'm a student nurse. I'm going to be helping you today. We're going to be doing a baseline assessment. So I'm just going to come in and I'm going to ask you what your name is and what your date of birth is. Okay, hi James, it's nice to meet you. Okay, I'm just going to close the curtain for privacy. I'm just going to come in, I'm going to look and make sure that the bed is locked. Just look for any safety, anything that can keep our patients safe. Okay, so perfect. We're just gonna get started. Okay, so how are you doing? Good, okay. We looked at your vital signs. Everything was looking pretty good, so that's good. We already checked that. Are you allergic to anything? Have any allergies? Okay. And are you taking any medication? Okay. Is there any past surgeries that you have had in the past that we need to bring up or talk about? Okay, perfect. And then I'm just gonna ask you a couple questions. So could you tell me what month it is? Okay, September. Okay, perfect. And do you know why you're here? Okay, perfect. Okay, and then I'm just gonna ask you to rate your pain on a scale from 1 to 10. This is a flag scale. This is just depending on the age of them. And yeah, anyway, so your pain is a 6. Okay, so I'm just going to talk about this with you using a scale called Caldera. So first, I'm just going to ask about the characteristics of it. If there's a stabbing pain, if it's aching, whatever it might be. Okay, and then the onset, when it happened, when you started feeling this way. And then the location of it. So if you can point exactly where it hurts. And then duration, so how long it lasts, so if it comes in waves or if it lasts long. And then exacerbation, so if anything makes it worse. And then radiation, so if it hurts in your side, does it go anywhere else? And then relief, so if anything makes it better. And then associated symptoms, so if you're having anything else, like if you're nauseated, throwing up, anything like that. Okay, perfect. Okay, so next I'm just going to look at your eyes. I'm going to use my little light right here. Okay, so we're just going to use Plura. So I'm going to cover this and then I'm just going to look at your eyes. Okay, so the pupils are equal, round and reactive to light and accommodation, so that's great. And then I'm just going to fill your head, make sure everything is right. I'm going to fill your lymph nodes. And then can you smile for me? Okay, perfect. Everything looks good. I'm just going to look in your mouth and your nose and your ears. Okay, perfect. It doesn't look like there's any drainage or anything, so that's a good sign. Okay, perfect. Okay, now we are just going to go into the next thing. So, do you have any chest pain that you've noticed recently? Okay, I'm going to listen to your heart if that's okay. So, we're just going to take a look at your heart. Okay, this is working. Okay, so, as I'm looking at your heart, I'm just going to pull this down just a little bit so that I can get a good listen to everything. So we're just going to listen to the aortic and then the pulmonic, Erb's point, tricuspid, and then mitral. And then on this point, we usually listen to this for 1 minute just to make sure that everything is going well with your heart. So I'm just going to listen to this for a minute. If we could start a timer for 1 minute. Okay, perfect. Okay, everything sounded good. We were able to hear S1 and S2, the rate and rhythm, everything sounded perfect. So that is a good sign. Okay, and then I wanted to ask you if you have had a cough or any troubles breathing recently. Okay, that is good to know. We are gonna listen to your lungs then. So I'm gonna listen in 6 different places to be able to hear and see how your lungs are doing. So I'm just gonna first listen right here and right here. Okay, I'm just gonna listen down here. And on this side. Everything's going good there. Now I'm just gonna sit you up so that we can listen to the back side of your lungs. So I'm gonna sit the bed up. Okay, I'm just gonna sit you forward. Just hold you up here. Okay, we're just gonna listen right here. And right here. Okay, then we're gonna listen right here. Right here. And right here. Okay, perfect. Thank you for letting me do that. Now I'm just gonna lay you back down after we listen to your lungs. Everything sounded good in all 6 places, so that was great. I'm just gonna lay you back down. And then the next thing that we're gonna do is we're gonna listen to your abdomen. We're gonna look, we're going to assess, we're just going to make sure everything is doing good. So we're going to, first we're gonna look at it, and then we're going to listen, and then percuss, and then palpate. So, just going to take your gown down for a moment. And as I do this, I'm looking at it, and everything looks good. And then we're gonna listen in all 4 quadrants. Okay, and that is really good because I was able to hear some sounds after 5 seconds of listening, which is really good. It's better to hear sounds. And now I'm just going to feel, and you let me know if any of this hurts you. Okay, so we were able to do that in all 4 quadrants, so that was great. Okay, now I'm just going to assess the skin. So I'm just going to look at your skin to see if the temperature is good, the tenderness, the color, the turgor. So I'm just going to pinch the skin right here. Perfect, you're hydrated, your skin looks good. Okay, as I'm feeling your arms, just let me know if any of this is tender, as well as in your legs. Okay, none of that was tender. Your color looks good, your temperature. It doesn't look like you have any edema, so no swelling. Everything looks good. Okay, I'm just gonna have you squeeze my hands. Okay, and then I'm just gonna have you push your feet against my hands. Perfect. And then for capillary refill, I'm just gonna squeeze your fingers, and then I'm gonna look. Perfect. Okay, good. And then I'm gonna listen to your radial pulses at the same time. Good. And then I'm gonna listen to your dorsalis pulses as well right here. Okay, perfect. That feels good. Everything looks good. Okay, and then do you have any wounds or anything that I should know about? As I was assessing your skin, everything looked good. Everything was looking fine, so to me, I didn't notice anything, but let me know if there's any wounds that we should take a look at. And then you don't have a catheter, you don't have IV, you don't have drainage, you're not on oxygen, you're on room air, so that should be good. So everything looks really good, and if you don't have any questions, then we should be good, and I will be back in later.